Hello, this is Gene Younger of Clear Vision Naturally. Keith called me yesterday and said, "Hey Gene, this stuff really works. I'm getting results, and my eyesight is getting better and better every day." In fact, Keith said, my eyesight's getting so much better that my old glasses don't work anymore. Whenever I put those glasses on, they feel too strong. It's kind of like I actually put on somebody else's glasses. This stuff started working for me when I found out the theory of natural vision and why the Bates method works. I started getting results immediately, and my eyesight starting to get better and better. Well, friend, if you're like me and you're like Keith, when you learn how and why natural vision correction works and how the Bates method works, you will surely see your vision and eyesight to begin to get better and better every day as you do these simple exercises and activities. The purpose of this video is to show you how the Bates method differs from the traditional medical model and why it's so possible for you to heal your vision and correct your own eyesight with this natural method of eyesight correction. There's hope for you too to heal your vision and correct your eyesight naturally without the use of artificial lens or having that dreaded eye surgery. How does natural vision correction work? And why is it so successful, you might be asking? Well, when you went to the eye doctor and complained about blurry vision or other eye problems, your eye doctor looked at the health of your eyes and checked your eyesight. In most cases, when they found that the health of your eyes were okay, they blamed your problem on your lens. They said, you know what, you've got a problem in your lens and we can do something about that. And they gave you three choices: glasses, contacts, or surgery. You went out of their office with a brand new pair of crutches. You went on your merry way, seeing much better, happy about that, but very ignorant of the long-term effect of this temporary solution. Now, near the end of this video, I'm going to tell you why there's so much hope for you who choose to learn and practice natural vision improvement, correction, and the Bates method. Well, in the first video, we looked at the fact that we see mostly with our mind, brain, and emotions, and we simply use our physical eyes. Bates thought it was about 90-10 ratio. The traditional medical model thinks of about a 10-90 ratio. Please know that Dr. Bates came to believe that the cause of poor eyesight was not in the lens of the eyeball, but in the length and shape of the eyeball. And the length and the shape of the eyeball affected the thickness and shape of the lens. In the case of nearsightedness or myopia, as it's called, at that point the eyeball shape is too long and the image does not quite reach the retina where it would be clear. The image focuses in front of the retina or before the retina and is therefore not clear but blurry. In the case of having trouble seeing up close, at that point your eyeball is too short and the image would be clear beyond the retina. So it's either too long or too short. And I'm going to show you in these illustrations what's going on. Here is a drawing of the myopic eye, or the eye of a nearsighted person. And you'll notice in this case that the eyeball, the shape of the eyeball is too long and the image does not quite make it all the way to the retina where it would be clear. Notice for a close-up of that. See, the image would be clear right on the retina, but since the eyeball is too long, it doesn't quite make it all the way. And that's the case of nearsightedness. Here is the case of the hypermetropic eye or the presbyopic eye. In this case, the eyeball is too short. This is the case of a person that can't see clearly up close. It's called farsighted because they can see clearly at a distance. So notice what happens to the image in this case. It goes beyond the retina where it would be clear. In this illustration, you see the normal eye, and notice that the image is refracted right on the retina where it's clear in the case of normal vision. I'll show you that a little bit in a little bit of close-up. So you can see the image meets the retina and is clear. Okay, you may be thinking, well, why are my eyeballs not going to where they're supposed to, where the image will be clear? What's keeping them from moving to the right place? What's up with that? The shape of the eyeball is controlled by tensing and releasing of 6 muscles on the outside of the eye. These muscles are called extraocular muscles. We don't really have much conscious control over them when it comes to refraction, but it's unconscious control. The muscular tension influences the shape of the eyeball, which in turn influences the shape of the cornea and the shape of the thickness of the lens, and this determines the refraction of your sight, how clearly you can see at a distance and up close. Same problem, eyeball is not the right shape. What was the root cause of blurry vision, you might ask? Well, Bates spent almost 40 years researching natural vision and teaching folks how to see clearly unaided by artificial lenses. This research resulted in his setting aside the standard vision theories and developing a methodology actually, to teach people how to see a new way and actually how to be a new way. In the next video, we're going to look at some of the causes of your poor eyesight. We're going to look at not only what can be done about it, but what causes it. What's keeping your eyeballs from taking their natural shape? When you want to look at something at a distance, when you want to look at something up close, why are your eyeballs not going to that place where the refraction would be correct? Now the good news, folks, is, and the best news is, that when you looked at my illustrations a minute ago, and you saw the eyeball was too long or the eyeball that was too short, in each of these illustrations I was exaggerating the distance from where the normal eye would be for you to see clearly. That's in myopia or in nearsightedness or presbyopia. The amount of change of the shape of your eyeball is tiny. It's a very little bit of change in the shape of your eyeball brings a huge change in the refraction of the image on the retina at a distance or up close. And that's a reason why folks get almost immediate results from doing these simple eye exercises and activities. That's why there's so much hope, because there's a tiny amount of change that needs to be made. Please watch this video several times until you understand this part of the theory of the Bates method. And hey, feel free to call me and personally when you have a question. You can find my phone number on the website. Anytime you want clarification, send me an email or call me. And until the next time, have a great day.